My name is Dr. Ramya Raman. I'm a Specialist General Practitioner and practice owner, and my practice is in Perth, Western Australia.
I grew up in country New South Wales. A lot of my outlook to medicine and care probably is ingrained in my country upbringing, and that is exactly what I'd like to really showcase with my patients. I studied medicine here at the University of Notre Dame in Fremantle, and then I did my terms in various hospitals, as every other doctor does, and then did my further specialist qualification with the Royal Australian College of General Practitioners. I do have a special...
To give you a bit of background, I'm actually a country girl. I grew up in country New South Wales in Orange, and after completing my school and my undergraduate degree, I moved to the Wild West, as it's called, for medical school. I've stayed back in Western Australia now, and I've lived in WA for the last 18 years. And my journey into medicine has been really quite a fun journey, but more interestingly, my journey into general practice has been even more fulfilling. And one of the key challenges that I faced when I was in the hospital system, particularly as a junior doctor, is I was really missing the opportunity to be able to talk to patients and actually bring them back in to have them reviewed, have further assessments. You know, often we see them in the hospital and we don't tend to see them again. And my turning point in my career at that point in time was something called the Pre-Vocational General Practice Program, where I rotated as a resident medical officer out of the hospital system into general practice. Mind-blowing experience. I realised how much I didn't know and how hard general practice actually was. I was working in general practice for 12 weeks under supervision and really learnt what it meant for continuity of care, chronic disease management, acute presentation, surgical management with regards to small surgical procedures, women's health, child health, geriatric care, palliative care, and the list can go on. And that was my turning point for me deciding that general practice was the specialisation that I was going to choose. As I went through my general practice training program, I ventured into medical education. And as of today, I've been teaching for the last 10 years and have been in academic and research work alongside being a medical educator. Medical education gives me the opportunity to be grounded, to be real, to be challenged and to be questioned. And I really thrive on that. I think that's really important as a clinician. It makes sure that we are actually up to date with our information, and the conversations that we have with our students and our registrars are so much more meaningful when that means a lot to clinical outcomes for patients. And today, when I actually see my students, and I've actually been to a rural trip in Albany and Denmark, the Denmark in Western Australia, I see my students who have studied with me working and training as a GP registrar in Denmark and Albany and telling me that they are really happy with the choice that they have made with choosing general practice as a specialisation. If there is a fulfilment that I have and that I really thrive on, it's that.
Advocacy plan, but as a state chair for WA, I can say that, you know.
One of the other hats that I wear is the chair of the RACGP in Western Australia and also the Vice President of the RACGP nationally. Advocacy. What do we mean by advocacy? Advocacy is not something that I deliberately chose to do, but I am doing it with intent because I feel it is absolutely necessary for our patients, for our communities, and for our general practitioners and our general practice owners as well. Going into it in a little bit more detail, I came into the college when I was a registrar, primarily can I help with medical education? What are the things that the college can offer? I came into the advocacy role in the college because there were things that were bothering me in general practice, including funding concerns, the fact that we are not being remunerated for the time that we spend with our patients, and our patients are needing longitudinal care and connectivity in that care, as well as needing appropriate remuneration for longer consultations. The amount of red tape, the amount of paperwork that we are doing in general practice, and often is quite unnecessary. Now, on the flip side, there is the aspect of things that we're doing really well. General practice is leading in digital innovation. We are embracing innovation within our practices to see how we can improve our efficiencies. We're really proud to be practicing GPs within any community within Australia, particularly our rural general practitioners, as well as our metro and outer metro general practitioners. As a GP, advocacy plays a key role, and the number one role as a GP that I play, and I say this to my students and registrars, is that you are the advocate for the patient. Keeping that hat on, one of the recent challenges that we have been seeing in Western Australia and across the country is the access to care for children as well as for adults who have neurodivergent conditions, particularly relating to ADHD. I have been instrumental in that role, and in Western Australia we have seen the changes come through. It did take 2.5 years of persistent advocacy, a lot of conversations, a lot of challenges, a lot of difficult conversations along the way. But when the facts are put in front of the team, particularly government, with the data that supports the fact that general practitioners are qualified medical specialists who can care for their patients within the community with the support of the non-GP specialists, ADHD reform is something that we saw with strength in Western Australia. Queensland was actually the first state to announce the ADHD reform, but the difference was that WA was the first state to announce the ADHD reform with funding allocation from the state government, which we negotiated, alongside ensuring that there was adequate educational support for GPs to be trained up so they feel confident, no matter where they are practicing in Western Australia, to care for patients who may need diagnosis and prescribing for ADHD. And that's not to say that non-GP specialist care is not needed. Of course it is. It means that we are embracing collaborative care. Team-based care, collaborative care is what we do best in general practice. And the truth of this is we are not being funded adequately to do the job that we do really well. For the state and federal governments, it is much, much more economical for patients to be seen within general practice, and we need to see better funding health reforms that support that over a longer period of time so that practices can be sustainable for all the reasons that I said above, which is acute care, chronic care, as well as all of the other specialist conditions that can be managed within general practice. What are the trends that we are seeing in general practice? General practice is the health engine of the health ecosystem. Preventative care, chronic disease management, acute care, after-hours care, men's health, women's health, child health, palliative care, all of these are well looked after, just to name a few, to be honest with you, are well looked after within general practice. So the question here is, how do we ensure that general practice is thriving within the community? At the moment, we have seen the Medicare freeze that was there for about 10 years. That meant that the patient did not receive the adequate patient Medicare rebates to see their GP, particularly for longer consultations. More than 50% of our patients in the community have a chronic disease. We need to keep that in mind when we're thinking about policy and when we're thinking about change. Greater than 50% of our general practitioners are women. That is a good thing that we are seeing within medicine as well as within general practice, and I'm really proud to say that as a female practitioner. But what that also means is that for general practitioners we are continuing to see a gender pay gap, and part of this is because of the health lens that the government has placed within general practice. About 5% of the federal funding goes towards general practice. A lot more goes towards the hospital. When a patient is seen in general practice, it's much more economical and cheaper, to be honest, for state as well as the federal government. So greater funding and strengthening general practice would actually mean that patients are much healthier, they can be kept out of hospital, and there's data to prove that they keep patients healthy and reduce the amount of times that they represent to hospital. So to summarise, what are the trends that we are seeing in general practice? Increasing chronic disease management. Patients are seeking longer time with their GPs, and appropriately so. We need to make sure that our general practice teams and general practitioners are appropriately respected and remunerated for this. There are alternate streams of practitioners which are being opened up for prescribing and dispensing. There is safety concerns in relation to this. The reality is the safety concerns are being voiced. We need to put it in perspective. Team-based care is best done within general practice. Our team-based care means that when a patient walks in through the door, as in my practice, they are able to see their general practitioner as well as other allied health colleagues who are supporting the general practitioner as well as the patient. And it means that they don't have to actually go outside of the practice to seek that care. But what we do need in general practice to have the continuation of that support is actually good funding models to support that. And as a GP, I'm really proud to call myself a general practitioner, and more specifically, a specialist general practitioner. Our patients value our care. We need to ensure that that value in care and that trust is actually embedded and seen by government to ensure that there is appropriate funding and support to see the sustainability and make sure that our general practices are not shutting doors. I want to open with an example. When I was a GP registrar and I was in training, I saw a patient of mine who had come in who had some difficulties with falling pregnant. It was a challenging journey for them, and I supported them through that process to ensure that they got the adequate medical attention from non-GP specialists, appropriate counselling, as well as looking after their general health, because I also do that in preventative care. In addition to that, there was some familial instability within her family. We helped support through that process. 5 years later, she fell pregnant, but the unfortunate circumstances is that she had a stillbirth. Now, that was a really eye-opening experience for me as a GP, and that too as a GP registrar. My patients teach me humility, and my patients keep me grounded. They teach you, or they teach me, to be a human being. The reality is, everyone needs a general practitioner who can look after them and walk beside them through their journey in their life. And the reality is, as a GP, I'm also growing in that journey alongside my patients. We talk about cradle to grave. The reality is, it is cradle to grave, but it is not episodic care. And that's something that's drawn me to general practice. I'm a very proud general practitioner, and I'm very passionate about what I do. And my passion comes through because I genuinely care about my patients, and I genuinely care about my profession and my colleagues. I would like to see that I would have another 30 or 35 years of general practice career in my life. I see general practice crumbling down, just bit by bit. And it is quite heartbreaking to see that, because the example that I used earlier on is only one example amongst the other 2 million consultations of general practitioners, consultations that are happening throughout a day within Australia, or perhaps the millions of consultations that is happening throughout the year. It's actually really important to consider this in perspective. It is the most economical way to actually fund a health system. A strong primary care, a strong general practice means that our communities are healthier, our communities are actually happier, and it reduces the load in our tertiary hospitals. We talk about ramping all the time. We hear about it on the news every second day. Why are we not fixing it with good general practice funding? We have received funding from the federal government, which has been a welcome funding after 10 years or maybe even 12 years. So it is excellent, but the patient demographics have changed. The dynamics of the workforce has also changed. And most importantly, the workforce distribution has changed in Australia. We need to re-look at all of these touch points, to bring it back in to ensure that our future generation of medical students are choosing general practice as their choice of specialisation. And more importantly, our general practitioners are retained within the profession in their clinical practice, as well as in education and other interest areas that they may have.